Now, so I spoke to, as I said, David Sitkovsky of Congressman Larson's office, and they wanted to know what kind of ideas I would put forth. And so I came up with a series of ideas. One was called an action plan, where action stood for, a cute little acronym, addressing care and cost through information and outreach nationally. And that's what I'm trying to do. This is not a national program, even though it ought to be. This is a local program, and it is information and outreach to you, my treasured viewing audience, and I hope you do enjoy this. But it's addressing care and cost. In other words, I want to show you how to have less care and lower cost for yourself, as well as those people who are paying the bills, like our health insurance. And that would be good in helping out health care reform. So that's the action program. And that's been developed through the guidelines which have been set up by the Preventive Medicine Center. And those guidelines are about blood pressure, which should be right around 120/80. Some people say 115/75. Some people say 130/80. The old 120/80 will do fine. A cholesterol, where you subtract the good cholesterol from the total cholesterol, and that number is 90. The diabetes test in the well population, an A1C of right around 5.5. A hemoglobin red blood count close to 14. In other words, as you start to get up to 15 and 16, the blood gets thicker, and so that increases the risk of heart attack and stroke. So right around 14. Should you donate blood if yours is high? I think that's a great idea. But the idea is, what are you doing to make it be that high? And that comes from all of the things we've talked about. Homocysteine, that's a chemical that a lot of people talk about. It is related to the future development of Alzheimer's, as well as the closing of those grafts that occur that are put in at open heart surgery. So you want that to be mid-range. There's another protein, lipoprotein little a. Now I have an article here where, what have I done with that quickly? Lipoprotein little a. Here it is. Genetically elevated lipoprotein little a and increased risk of myocardial infarction. Now, you don't need to read that, but the point being, that's what the article says. It is from the Journal of the American Medical Association, June 10th. In other words, just a month ago. And I got a call from an insurance company who said that they were not going to pay for that because it wasn't an established risk factor. This article and many other articles clearly show that it is an established risk factor, and so lipoprotein little a needs to be about mid-range. And there are treatments for lipoprotein little a. It's called niacin. And yes, that can be a little tough in several different areas. As a physician, you have to know what you're doing. And even then, it is always a best guess, because if you remember my Health's 10 Commandments, all drugs can be toxic, all drugs are poison, all drugs can cause side effects, all drugs have the potential to do harm as well as good. And so it is important to be well, to use as few as possible, and I include that in the vitamins and the minerals and the various supplements that people are taking. And when it comes to those vitamins, minerals, herbs, and supplements, I say after an introductory period of taking them daily for 14, maybe 30 days, occasionally up to 60 days, then reduce it to 4 or 5 days a week and use my little acronym WWO, Wednesday and the weekend off. So lipoprotein little a mid-range, homocysteine mid-range, A1C about 5.5, magnesium level about 2.1. The clear lines of definition, the non-smoking, the alcohol limited to 4 drinks a week or less. And you might say, well, what if I had 5 one week? Look, this is not about rigidity. We're talking to human beings here, and I hope and expect that the audience, if it has any questions, please feel free to call me at the Preventive Medicine Center, 549-3444. Well, I think that is the idea of how that meeting went and what kinds of ideas I put forth and what the guidelines for the Preventive Medicine Center are. And if, as my son says, send millions fast, so that we can make this program be a kind of go and help the nation in this health care reform issue. Now, here's some ideas that I wanted to go through. Asthma, I have talked about a vitamin D level. Oh yes, that's in the Preventive Medicine Center guidelines. A 25 vitamin D level of close to 50. Some people say 30, some people say up to 100 is okay. I will settle sort of right in the middle there at about 50, and that's a very healthy level. And it says asthma is worse in children who have low vitamin D levels. Now, a few months ago, there was a big craze on, maybe it's longer than that, for pomegranate juice. And interestingly, here is an article that says pomegranate juice is associated with a slowing of the growth of cancer of the prostate. Curcumin, which is what's in curry, Indian food, but you can buy it as a vitamin, vitamin or supplement, reduces the formation of fat tissue in mice. And all of these are good little ideas that you want to go into the back of your head. Do not rush out and buy curcumin. Do not rush out and buy pomegranate juice. If you want to buy pomegranate juice and cook with a little curcumin, or get a supplement and taking it WWO, Wednesday and the weekend off, I have no problem with that. Inflammation reduced in those with higher vitamin D content. Remember the cardiac HSC reactive protein, which is also in my guidelines and should also be, actually the guidelines of the Preventive Medicine Center, and here I am putting them forth, should be right around 1. And any increment above that may be associated with an increased risk of heart attack, and probably cancer too, because that which causes heart disease is the very same thing that causes cancer. And what usually happens is those people who are genetically resistant to the heart disease end up developing the cancer, and those people who are genetically resistant to the cancer end up developing the heart disease or the diabetes for doing exactly the same things. So inflammation is reduced in those with higher vitamin D levels. Online games influence children's food choices, and you can be assured that the people who make various kinds of foods oriented towards children are well aware of that. And just like in the movies where they're now putting brands of this or that, they show very clearly what brand of orange juice they're drinking or what type of car they're driving. Those companies have paid for that to appear in the movies so that to influence the viewing audience. And here I am trying to influence the viewing audience, encouraging you to be moderate. When you take supplements, take them 4 days a week, at the most 5 days a week, to eat a diet that is 90% or ideally organic, grains, vegetables, beans, fruit, nuts, and seeds. Eat more or less only out of a bowl. Don't eat off of a plate, because we tend to put fish and chicken and meat and cheese and eggs and ice cream on plates. Eat out of bowls. By the way, there's some very tasty rice ice creams. They taste much better when you let them melt towards room temperature. That was one of my favorite things when I was a little kid.